Hi, I'm Jerry Heindel, and I focus on how endocrine disrupting chemicals can disrupt your health. And since it's springtime, I changed from t-shirts to flowered shirts. So the question today is, do you know that fetuses and young babies are much more susceptible to endocrine disrupting effects of toxic chemicals than adults? And the reason is simple, because fetuses and babies are not adults. They are developing, they are under construction, and it's hormones that are doing the construction process. They are controlling the stem cell differentiation into specific tissues like a kidney or a liver. And they do that by turning genes on and off. They tell cells when to divide, when to stop, when to move, when to interact with other cells. This is a highly organized and orchestrated process. So it makes sense then, if you have an endocrine disrupting chemical present, they can disrupt these processes by the fact that they can add more hormone or less hormone, or the hormone at the wrong time or the wrong place, leading then to a tissue that looks like it's a normal tissue, like a kidney or liver. But when you get down to the molecular and cellular level, there are some abnormal pathways and genes that make these tissues then more susceptible to diseases later in life. And all of these changes are then permanent when the tissue is finished forming. This process is called the developmental origins of health and disease. So if you really want to protect your babies from endocrine disrupting chemicals, the best way to do that is to reduce exposures prior to pregnancy, during pregnancy, and in the first 2 years of the baby's life, when the immune system, the adipose tissue, and the brain are still functioning. If you want to know more, follow me as I continue discussing this process.